All right, Charlie, we have another story for you out of California this morning, and it's a special contributor, Patti Davis, daughter of President and Mrs. Regan, who has written a number of essays you may have read, eloquent and provocative essays about her life. Well, this morning, an extraordinary personal story, because in this era of unquestioned plastic surgery, she's going to tell you what happened when she decided to change her nose and learned, among other things, that fixing plastic surgery is now a specialty all its own.
I thought it was probably a good idea to maybe be able to breathe properly when I was sleeping for the state of my marriage. I thought this was going to be a really simple thing, that I'd come out and I'd have an attractive nose and also be able to breathe, neither of which happened. Most of the cartilage was taken out, hence the shapeless, mushy thing that I ended up with. It was also broken unevenly, so my breathing, I think, ended up even being worse. And I walked down the aisle in my pretty dress, smiling with a very wide, shapeless nose. I didn't hate my nose before. I did hate it afterwards. If I could have gone back to my old nose, I would have done that. I thought, well, I've got to get this fixed. So I went to another doctor, and I was a bit confused, the next 3 surgeries. One of them actually made it even more lopsided. So it was good, and still I couldn't breathe. I thought, if we can go to the moon, why can't I get my nose fixed?
Nose is arguably the most difficult operation in plastic surgery, because there's an infinite number of variations that you can put on a nose.
After 4 disappointing surgeries, I turned to this man, Dr. Stanley Frileck, one of the few plastic surgeons in the country who specializes in redoing procedures that didn't go right the first time. How much of your practice is redoing botched jobs?
About 25 to 30% of my practice is that, and that's a growing number.
So one of the first things he said to me, it might have been the first thing after hello, was, your nose doesn't fit your face. And I went, oh, thank you. You know, because no one else had said that. I knew that to be the case. I knew that that I had this sort of wide, shapeless, cute. That was the buzzword for me. If someone said, oh, your nose is cute, I'd go, well, you're not operating on my
That very notion that somebody might think your nose is cute is the essence of what we're talking about. Mm-hmm. It's his or her take on your nose, your face. And when that doesn't jibe with the way you think about it, there's a problem.